يلا إن شاء الله.
Sure. Good morning. Our topic today is about imaging in chronic pancreatitis. Chronic pancreatitis is a progressive, irreversible inflammatory damage to the pancreas, resulting in parenchymal fibrosis, morphological changes, and loss of endocrine and exocrine function. And it is not the same as recurrent pancreatitis. We should not mistake between the two. The chronic changes including atrophy, calcification, and ductal distortion, and it can cause impaired exocrine function, pancreatic or biliary structure, and it is associated with significant increase in the pancreatic cancer incidence. It usually affects middle-aged adults, and in hereditary pancreatitis, it may present below 20 years of age. It affects the male more than the female. The many causes contribute to the etiology of chronic pancreatitis. Most commonly caused by alcohol abuse, with persistent heavy alcohol consumption for more than 10 years, usually required to develop chronic pancreatitis. It can be idiopathic, but we should rule out first the hereditary causes of pancreatitis, autoimmune pancreatitis, and systemic disease involved with causing pancreatitis, such as cystic fibrosis, hyperparathyroidism, and the chronic kidney disease. The obstructive chronic pancreatitis may be due to narrowing or stricture of the ducts, including congenital abnormalities that predispose to chronic pancreatitis, which are pancreas divisum, annular pancreas, tumors, and sphincter of Oddi dysfunction. Toxins such as tobacco may produce to the etiology. Gallstones, hyperlipidemia, trauma, and drugs often cause acute and recurrent pancreatitis, but rarely cause chronic pancreatitis. It may present as recurrent or chronic mid-epigastric pain, typically radiate to the back and worsen after eating. It is associated with endocrine and exocrine deficiencies due to progressive destruction of the gland, which may cause steatorrhea as a cause of malabsorption, diabetes mellitus, and jaundice. Morphological changes on the imaging may correlate with the endocrine and exocrine function. يعني من خلال المورفولوجيكال change ممكن نعرف هل انه صار loss بالاندوكراين او exocrine function. من خلال إذا لقينا big duct disease with the gross abnormalities of the main pancreatic duct often result steatorrhea and diabetes, while small duct disease with normal main pancreatic duct and relatively normal appearance of the pancreas are likely to produce steatorrhea and diabetes. Early diagnosis of chronic pancreatitis is difficult. Biochemical studies usually does not help, as amylase and lipase not reliable. They may be normal or minimally elevated. Diagnosis at this stage is suspected based on the combination of a clinical symptom, the pancreatic function test, and the radiological investigation. The definitive diagnosis of chronic pancreatitis is usually established in advanced cases, يعني يجينا بالlate stage, with destruction of greater than 90% of the parenchyma. أهم شيء بالdiagnosis أو أكثر شيء نعتمد عليه بالdiagnosis هو role of imaging. The role of imaging make diagnosis. It might contribute to finding underlying cause, such as mass or stricture, and evaluate exocrine function by secretin stimulation test. The best diagnostic clue for chronic pancreatitis is atrophic pancreatic parenchyma with dilated, beaded main pancreatic duct and intraductal caliculi. الإيمجينج modalities اللي نقدر نشوف بيها الكرونيك pancreatitis تبدي من الابدومينال راديوجراف، ultrasonography، الكمبيوت CT and multi-detector CT scanner، الMRI والMRCP والsecretin stimulation MRCP، الERCP and endoscopic ultrasound and shear wave elastography. Regarding the radiography, بالplain film, we may demonstrate small irregular or coarse calcifications, local or diffuse, مثل ما نشوف بهاي الصورة, diffuse calcification at the area of the pancreas in the epigastric region. Calcification in chronic pancreatitis is the most specific feature. However, it occurs in late course of the disease. Regarding the upper GI series, we may reveal changes in the second duodenum, barium meal. We may see thickened, irregular mucosal folds, luminal narrowing, and varying degree of atony with dilatation of proximal duodenum with or without the stomach. Regarding the pancreas should always, regarding the ultrasound, the pancreas should always be assessed in the fasting state and using a graded decompression. Several maneuvers have been used to assess pancreas, such as distending of the stomach with the fluid, scanning of the patient in oblique position using spleen as acoustic window, هاي technique usually تفيدنا بالتيل visualization of the tail of the pancreas. Other techniques are asking the patient to bloat the abdomen during the scan and the scanning in the sitting position. Regarding the ultrasonographic finding with chronic pancreatitis, usually you find dilated main pancreatic duct more than 3 millimeters with or without dilatation of the common bile duct with echogenic parenchymal and ductal calcifications with posterior acoustic shadowing. إذا كانت هي شوية large in size, but tiny calcification usually not seen on routine sonogram. It can be identified with colored Doppler as a result of twinkle artifacts. The gland may appear hypoechoic and heterogeneous. ليش؟ لأنه focal hypoechoic areas and hyperechoic areas within the gland representing inflammatory and fibrotic tissues. Discontinuous structures within the duct may give a chain of lakes appearance, and the pancreatic ductal caliculi may be seen with which might obstruct the ducts, resulting in repeated attacks of pancreatitis. مثل ما نشوف بهذه الصورة إن أكو ductal dilatation and caliculi inside it with atrophy of the pancreas. هنا نشوف بالصورة الثانية إنه أكو calcifications within the parenchyma of the pancreas. Other important findings in the chronic pancreatitis can be detected with sonography are السيدوسيست ممكن نشوفها, thrombosis of the splenoportal axis and the portosystemic collaterals, and arterial complications such as aneurysm, most commonly of splenic artery or the gastroduodenal artery. And we ممكن نشوف أيضا ascites during routine ultrasound examination. Ultrasound may also assist to differentiate between autoimmune type versus the acquired type. عادة الautoimmune type يكون البنكرياس enlarged either focally or diffusely, بينما acquired type عادة ما نشوف إنه there is calcification. Now widely used the endoscopic ultrasound examination عادة يفيدنا بالdiagnosis of early stages of the chronic pancreatitis. It has sensitivity and specificity of 83% and 80% respectively for the diagnosis of the chronic pancreatitis. Normal pancreas بالendoscopic ultrasound يكون homogeneous appearance, smooth margin, and slightly hyperechoic to the liver, someone a salt pepper appearance, and with normal main pancreatic duct and anechoic wall. Multiple criteria involved in the diagnosis of chronic pancreatitis using endoscopic ultrasound. نقسمها إلى parenchymal abnormalities and ductal abnormalities. The parenchymal abnormalities يكون hyperechoic foci and hyperechoic strands, lobulated parenchymal contour and cyst مثل ما نشوف هنا strands, hyperechoic strands. والductal abnormalities عادة نشوف dilated main pancreatic duct, irregular main pancreatic duct, hyperechoic duct wall, and visible side branches مثل ما نشوف هذه الصورة إنه there is visible side branches with dilatation of the main pancreatic duct. The Rosemont criteria for endoscopic ultrasound diagnosis of chronic pancreatitis نقسمها إلى major criteria والminor criteria. المajor criteria بها A و B. المajor criteria A هو hyperechoic foci with shadowing or main pancreatic duct caliculi. المajor هي lobularity with honeycombing. الماينر criteria تتراوح عن cyst, main pancreatic duct caliber more than 3.5 mm, irregular duct contour, side branch, ectasia, and others. To be consistent with to diagnose chronic pancreatitis لازم عندنا one major A feature plus more than 3 minor feature, or one major feature A feature and major B feature, or 2 major A features. The new modalities involved in the diagnosis of chronic pancreatitis اللي هي contrast enhanced endoscopic ultrasound, which is particularly useful in patients with renal failure as microbubble contrast agents are not nephrotoxic مثل ما نشوف هنا by using microbubble contrast agents with endoscopic ultrasound. Other modalities now use the endoscopic secretin pancreatic function test. It is done by following intravenous administration of synthetic secretin and taking duodenal aspirates collected at 15, 30, and 45 minutes. A peak of bicarbonate concentration less than 80 is suggestive of exocrine insufficiency. Widely used now also in the diagnosis of chronic pancreatitis is the elastography with endoscopic ultrasound. Elastography can be used with transabdominal or endoscopic with conventional strain elastography or by shear wave elastography. In chronic pancreatitis, there will be fibrosis of the gland which lead to progressive increase in the glandular stiffness. مثل ما نشوف هنا إنه بالelastography patient with chronic pancreatitis show heterogeneous stiffness of the pancreas with hard areas and areas of intermediate stiffness. بينما بالصورة الثانية B elastography show mass is hard area as a hard area. Computed tomography عادة ما نستخدم المالتي فيز بروتوكول اللي هي بري كونتراست pancreatic phase اللي هو البيست phase to assess the arterial enhancement for surgical mapping and to study arterial complication. And the last phase will venous phase will show enhancement of the pancreatic parenchyma. This phase is best suited to evaluate the parenchyma of the pancreas and pancreatic duct, focal lesions, and collection. The sensitivity of the CT in detecting the late stage of chronic pancreatitis is 60 to 95%. The early stages may not produce visible changes, but morphological abnormalities are more apparent in the late stage. عادة ما نشوف إنه dilated, beaded, irregular pancreatic duct with stricture مثل ما نشوف هنا بالصورة C, D, and E. Pancreatic parenchymal intraductal calcification virtually diagnostic of chronic pancreatitis. عادة ما نشوف also pancreatic atrophy more apparent in the body تكون and the tail and intra and peripancreatic pseudocyst. Splenic vein often thrombosed with resultant varices and splenomegaly. Fibroinflammatory mass related to chronic pancreatitis may be very difficult to differentiate from malignancy. Most common, it is occur most commonly in the head and may demonstrate variable enhancement while you have diagnostic difficulty. Hypoenhancing mass usually due to fibrosis, while isodense mass imply the lack of fibrosis. وتخلينا نشك إنه ممكن تكون malignancy, as shown here in this picture. Alcohol-induced pancreatitis and hereditary pancreatitis show calcification in the gland at relatively earlier stage than other causes of pancreatitis, and the presence and the number of parenchymal calcification is a predictor of the degree of the pancreatic fibrosis. هنا نشوف coronal reformat image of contrast enhanced CT scan show dilatation of the pancreatic duct from a structure in the head of the pancreas with dilated side branches of the pancreatic duct and extensive parenchymal calcification اللي هي diagnosis of chronic pancreatitis. بالصورة الثانية الأكزيال image from contrast enhanced CT scan in the same patient شوفنا إنه extensive parenchymal calcification بهذا البيشنت required enzyme replacement therapy due to exocrine insufficiency due to extensive calcification within the gland. هذا ملخص للفيتشرز اللي ممكن نشوفها بالCT scan. Regarding the MRI and MRCP, the normal MR appearance of the pancreas, the parenchyma diffusely high signal on T1 weighted image more than the liver, and it has a variable signal intensity on T2 weighted image. The pancreas enhance avidly and homogeneously on T1 weighted image. Contrast image عادة يكون hyper intense to the liver on arterial phase and iso intense on the delayed phase. النورمال pancreatic duct measurement مثل ما نعرف إنه تكون أقل من 3 ملم. The MRI more sensitive for early changes of chronic pancreatitis compared to the CT. الفايندنج اللي نشوفها بالMRI هي loss of normal high T1 signal of the parenchyma due to fibrosis replacing the parenchymal proteinaceous fluid, diminished parenchymal enhancement on T1 weighted image, contrast image on arterial face with increased delayed enhancement due to fibrosis. يكون increased delayed enhancement بسبب الفibrosis. Pancreatic atrophy and pseudocysts نشوفها بالlater stages. Regarding the MRCP, the changes in the pancreatic duct usually عادة تكون later finding. It is nicely demonstrated by MRCP. عادة ما نشوف إنه dilated duct أكثر من 3 ملم with irregularity and structure and dilated side branches اللي هي chain of legs appearance. Stones within the pancreatic duct may appear as signal void. نقدر نستخدم الكامبريدج criteria for ARCP على مود الدايجنوسيس. الكامبريدج كرايتيريا 1 هو نورمال عاده ما يكون نورمال بانكرياس. الكامبريدج كرايتيريا 2 يكون ايكوفوكال نشوف بها dilatation or obstruction of less than 3 side branches with normal main pancreatic duct. الكامبريدج 3 عاده ما يكون mild disease نشوف بها dilatation and obstruction of more than 3 side branches with normal main pancreatic duct. while الكامبريدج 4 يكون moderate disease نشوف بها Cambridge 3 criteria with stenosis and dilatation of the main pancreatic duct. While Cambridge 5 اللي يكون severe disease نشوف بها Cambridge 3 or 4 criteria plus additional obstruction, cyst, stenosis of the main pancreatic duct or caliculi. Used nowadays the secretin enhanced MRCP for functional evaluation of the chronic pancreatitis. Secretin MRCP can help to visualize earliest finding of chronic pancreatitis and evaluate pancreatic exocrine dysfunction. Loss of the normal duct distension due to decreased duct compliance after secretin administration is diagnostic of chronic pancreatitis. Normal duct عادة dilate more than 1 millimeter compared to the baseline after administration of secretin. The secretin may improve visualization also of the side branches, which are, إذا شفناها, suggestive of chronic pancreatitis. Decreased secretion of fluid into the duodenum suggests pancreatic exocrine dysfunction by using the secretin enhanced MRCP. نقدر نسوي grading. Grade 1 fluid seen in the duodenal bulb اللي هو most suggestive of pancreatic exocrine dysfunction. Grade 2 fluid seen in the second portion of the duodenum. Grade 3 fluid reached to the third portion of the duodenum. نقدر نستخدم diffusion weighted imaging also in the diagnosis of the chronic pancreatitis. Diffusion imaging has evolved in the assessment of pancreatic disease. Normal pancreas show no restriction of diffusion due to presence of a free movement of the water molecules. Hence, the ADC is high in normal pancreas. While in cases of chronic pancreatitis, there is restriction of the diffusion of water molecules resulting in dropping in the ADC signal. مثل ما نشوف بالصورة هنا. الARCP هو gold standard test for chronic pancreatitis. The findings include a dilated irregular beaded main pancreatic duct with sites of structure and dilated side branches. ممكن نشوف أيضا intraductal stones appear as a filling defect within the main pancreatic duct. Intrapancreatic portion of the common bile duct may be narrowed but demonstrates smooth tapered narrowing. هذا اللي يفرقها عن المالجنسي. ده عادة يكون المالجنسي abrupt narrowing. May produce double duct sign due to structure of the distal common bile duct and main pancreatic duct, which may mimic the malignancy. The FDG PET scan, in order to obtain biochemical and structural information, we use the FDG PET scan with CT and more recently with MRI to assess the focal pancreatic lesion. The standard uptake value, the SUV value of the FDG is significantly greater in malignant masses of the pancreas compared to the focal pancreatic mass. عادة تكون ال SUV value أعلى بالmalignancy than the other focal pancreatic mass. The SUV value more than 4 is usually seen in pancreatic carcinoma, while SUV value of 3 to 4 more commonly seen in cases of focal pancreatic masses in chronic pancreatitis, while SUV value less than 3 is seen in healthy individual. However, focal lesions in autoimmune pancreatitis have high SUV value, and there is no significant difference compared with the pancreatic. So إن مشكلة in case of autoimmune pancreatitis ما راح نقدر نفرقها عن الكارسينوما، لأن يكون the SUV value بالautoimmune pancreatitis high also. الايمجنج ريكومنديشن السمري انه الاي ار سي بي هو الجولدن ستاندرد with high sensitivity and specificity. Endoscopic ultrasound is sensitive مالته 81% while specificity 90%. البيست طبعا هو الام ار والام ار سي بي. ليش؟ لانه non invasive imaging techniques. while الاندوسكوبيك ultrasound نقدر نستخدمه in the diagnosis of early stages of the disease, and the ERCP is used primarily for the intervention, stone extraction, or by putting a stent. Special varieties of the chronic pancreatitis عندنا autoimmune pancreatitis اللي هو immune mediated fibroinflammatory disease involving primarily the pancreas, which respond to steroid therapy. It can cause 5 to 6% of chronic pancreatitis cases with no history of alcohol abuse, smoking, or biliary stenosis. عندنا two distinct forms اللي هو type 1 and type 2. type 1 هو lymphoplasmocystic sclerosing pancreatitis اللي يكون ب positive IgG4, والtype 2 idiopathic duct-centric pancreatitis واللي occur in younger patients, where male to female ratio is equal. The imaging finding of autoimmune pancreatitis عادة B2 types be diffuse form والfocal form. The diffuse form يكون sausage-like enlargement of the pancreas as seen in the picture with the arrow, with smooth contour and loss of normal pancreatic lobulation. Hypoattenuating halo or capsule around the pancreas with absence of retroperitoneal fluid collections, pseudocyst, or inflammation. Less enhancement than expected in the arterial phase, while parenchymal capsule may show delayed enhancement. Diffuse or segmental narrowing of the pancreatic duct with MRCP, multiple discontinuity of the main pancreatic duct and the bile duct structure, which resolve after secretin. اللي نسميه duct penetrating sign. الfocal form عادة يجي as a focal mass or localized enlargement of pancreas, usually يكون بالhead or بالuncinate process with delayed enhancement, with lack of biliary or pancreatic duct dilatation. The top 3 differential diagnoses of autoimmune pancreatitis هو pancreatic ductal adenocarcinoma, chronic pancreatitis, and acute edematous pancreatitis. هذا example of autoimmune pancreatitis. Axial CT scans show sausage-like appearance of the pancreas. Other variety of chronic pancreatitis is the groove pancreatitis, which is a form of chronic pancreatitis affecting the pancreaticoduodenal groove. B2 forms, the pure form اللي affect only the pancreaticoduodenal groove, and the segmental form اللي affect the pancreaticoduodenal groove and extend medially into the pancreatic head. The pancreatic groove is a theoretical space defined by the pancreatic head medially, second part of the duodenum laterally, the third part of the duodenum and IVC posteriorly, and the duodenal bulb superiorly. It contains the distal common bile duct, accessory pancreatic duct, and the major or minor papillae. The clinical difficulties or the clinical issues regarding groove pancreatitis is usually affecting the middle-aged men with history of alcohol abuse, obstruction of يعتقدون انه بسبب obstruction of the accessory pancreatic duct. بالacute setting عادة يجي patient with postprandial abdominal pain, vomiting, or acute gastric outlet obstruction لأنه عادة ما يكون ماس هو. بالchronic setting يجي as a chronic weight loss with jaundice. The amylase, lipase, and the tumor markers are usually normal, وهذا نفرق بها عن malignant cases. Prospective diagnosis is very uncommon. عادة يعني ما يقدرون يميزون between المالجنسي وبينه، ولهذا diagnosed by surgery. عادة ما يسوون surgery وديagnosed بالhistopathology. Imaging, it appears as a sheet-like curvilinear soft tissue mass between the pancreatic head and the duodenum, may demonstrate delayed enhancement. بالMR, usually T1 hypointense with variable T2 signal depending on the acuity of it. It have a thickened medial duodenal wall with or without cyst within the groove or thickened duodenal wall. A segmental form عادة ما يجي mass-like enlargement of the pancreatic head، وهذا هو اللي يكون لنا diagnostic difficulty with the malignancy. Calcification and ductal dilatation and bleeding can develop in a chronic setting of the disease. The differential diagnosis of groove pancreatitis هو pancreatic ductal adenocarcinoma, duodenal carcinoma, and acute edematous pancreatitis involving the groove. Thank you.